It's a privilege to moderate this esteemed panel on the vital topic of improving public healthcare and the role of private hospitals. These days, healthcare is becoming more and more of burden for people, whether it is rising costs or out-of-pocket expenditure or just getting the access to the care they actually need. You can't ignore the growing tension between what the public healthcare can actually offer and the expanding influence of private hospitals. Private institutions have no doubt stepped up whenever public healthcare has actually faltered. But then there are some serious questions to ask. Are we at the risk of turning healthcare into something only the privileged can afford? Can private hospitals really support public health without always putting profit first? Will private medical insurances actually become a hindrance or, to access healthcare? What are some concerns that private hospitals face to support the government in their health schemes? These are some of the real challenges that we need to tackle as we look at how private hospitals can help ease the strain on our healthcare system and make public healthcare accessible to all. To begin, let me introduce two esteemed doctors, Padma Shri and Padma Bhushan awardees, whose contributions have significantly shaped Indian healthcare, Dr. C.N. Manjunath and Dr. Nageshwara Reddy. It's my privilege to introduce Dr. C.N. Manjunath, a visionary leader in Indian cardiology and the driving force behind the transformation of Karnataka's Jayadeva Institute of Cardiology into a world-class healthcare institution. With over 16 years of dedicated service as its director, Dr. Manjunath has raised the standards of the public institution into nothing less than a private healthcare hospital. Recently elected as Member of Parliament from Karnataka, Dr. Manjunath carries a philosophy that healthcare should touch every life, no matter how remote. His insights on balancing public and private healthcare will be invaluable as we discuss the future of healthcare in India. We welcome you, sir. It's my pleasure to introduce Dr. Nageshwara Reddy, a Padma Shri and Padma Bhushan awardee and a true leader in gastroenterology. He is the chairman of Asian Institute of Gastroenterology in Hyderabad, which you might know as AIG Hospitals. Dr. Reddy isn't just about medical excellence. He is also deeply committed to giving back to society a value he says he got it from his father, Dr. Bhaskar Reddy, a well-known pathologist. Dr. Reddy, in an interview which I was listening to, he mentioned that his father once called him at the dining table and said, I'm very disappointed with you. So when Dr. Reddy was confused, wondering, he had got into medicine, he had started his practice, he was earning good money for himself, so where have I really gone wrong? Dr. Bhaskar Reddy apparently then said that professional success is important, but what have you done as a doctor to the society? Have you done your research? Have you done any research? Have you started any institution? Or you're only making money for yourself and that is not success. Dr. Reddy says this belief has been guiding force in his career, ensuring his work benefits not just the elite, but everyone who needs it. With his extensive experience and leadership in private healthcare, I'm assuming that he's going to bring all the challenges that private healthcare actually faces in collaborating with the government. We welcome you, sir. Without much ado, I want to ask the first question to Dr. Manjunath. Dr. Manjunath, first of all, what were the key challenges and strategies in transforming Jayadeva into a top cardiac care center? And how did you balance affordability with excellence?
Yeah, first of all, many thanks for invitation to be this unique model of conference, because this is where we have to take it forward. All the time we are talking about technology, explosions of technology, and regarding market forces. This is one unique meeting. The agenda was regarding longevity and prevention, and because prevention is always better than cure and precaution is still the best. So that is the unique model. This sort of meetings we should have rather than discussing about only diseases and diseases, because this is one thing. And this creates a lot of awareness among the people. The awareness program is very, very important. And because there is no happiness in medicine, but there is medicine in happiness. That's a very popular saying. So, and we have to take care of an extension, of course, this discussion, before getting into the actual discussion, we have to take care of 6 S, that is salt, stress, spirit, smoking, and physical activity and sugar and salt. Sugar. Sedentary life, salt, stress, spirit, sedentary activity, and sugar and smoking. These are these things. And as we discussed, anyway, today nearly 35% of healthcare services is given by the public sector. Another 65% is given by the private sector, only 35% by the public sector. So we need to work in tandem. So that is very important. See, in a public institution, one of the biggest challenges, one is on the infrastructure side, and the second is there will be a lot of inertia. So one of the biggest challenge in an institution is to really manage people. Managing people is one of the biggest thing. Managing because they have a different mindset, they have different culture, and to bring a corporate culture in a government setup, it is extremely a difficult task. And this is where the leadership matters. We have to take everybody together. That's very, very important. And most important, you should allow space for others to grow in the organization. So you should allow, because, with your talent, with your hard work, with your skill, you can reach the top position, that's fine. To remain in the top position for a longer time, your attitude and your behavior and all those things matters. So another important thing is, one of the biggest incentive for the growth of an organization is non-interference. That is one of the biggest incentive, whether it is a government institution or whether it's a private institution. Non-interference is one of the biggest incentive for the growth of an organization. And another important thing in a public thing is, yesterday I was talking in the parliament about the same topic. What happens, yes, our focus always in a government setup, what happens is only on construction of an hospital or construction of a medical college. But we have to change, there has to be a transition from construction to creation of posts, from creation of posts to recruitment. So what is happening, we are focusing only on construction. Yes, fantastic physical structure will come, but where are the posts? So this is where we have to really balance, and we have to create an atmosphere of ownership in a public institution. That is again leadership. People should be strong, and there has to be some mechanism of decentralization, and also decentralization mechanism should be there. You should not try to really centralize the whole thing as head of the organization. You have to give some freedom, and you should also take everybody together. You should be a great listener. You should be a great listener. A listener is a leader. That's what a popular saying says. And another important thing is, you have to have a good rapport with you should have a good rapport with the government. That's very, very important. Many times I have realized lot of good things can be done with the goodwill of the bureaucrats. The goodwill you have with the bureaucrats we can have a lot of impact. Because when I took over Jayadeva Institute of Cardiovascular Sciences in 2006, the bed strength was 300. Today we reach 2,000 cardiac beds exclusively for cardiac care. Nowhere in this thing. Nowhere in India we have a cardiac institute with 2,000 cardiac beds. See, the problem is, yes, with government grants alone is not sufficient to run a public institution, because they have a fixed grant. So this is wherein we have brought in a public-private partnership. 3 P's we call it as public-private partnership. See, the other 2 P's will come if the first P is strong. If public institution is strong, and we roped in about 50 charitable organizations to support the treatment. But of course, most important is if they are convinced, whatever donations they give, whatever the philanthropic activity they do, if they are convinced if it is going for a right cause, then only funds will flow. So in fact, one of the biggest thing I have to mention here, our Infosys Foundation chairman Sudha Murthy and Narayan Murthy, they have built in a 350-bedded world-class cardiac hospital in the same premises and handed over to us. So they asked me one question, Manjunath, how much of tenure is left as a director for you? At that time, it was 3 years. Then they said, we are going to build because we have a strong faith on you and trust on you. So then November 2021, this facility was handed over to us, November 21st. November 24th, we started working with full faculty. So, so these are some of the important things. And again, we have to bring some amendments because government rules are a lot of throttling effect. Just for example, in fact, we are the first institution in the country to introduce an incentive scheme to prevent brain drain among the faculty in 2007 itself. This was based on performance, productivity, and punctuality. There was a lot of opposition from the government. No, Manjunath, if you ask, even other institution will ask, other medical colleges will ask. So then I told them, no, you just put a rider. You give permission to start an incentive scheme, not from government grants. It is only subject to effective internal resource mobilization. Then nobody will blame. So because the mindset of our people is, you give even 10 lakh salary. They are not, they don't talk about salary. You give just 50,000 in incentive, they only talk about that 50,000 incentives and all. Then other thing is creation of post. I will tell you, that is the biggest challenge in a public sector. They always approve. So this is where, when a government clears a project, whether it's a medical college or a multi-speciality hospital or a super speciality hospital, in the same cabinet decision, the post should be approved. Otherwise, you have to go around and those things and all.
Right, sir.
Then promotions should be given on time. That is the only way we can help keep them in good spirit. What I have done, if somebody is eligible for promotion on Saturday, I had given them on Friday. So I had given them on Friday. And we have created more units. You don't believe that institution today has 125 cardiologists, only one single institution, 125 cardiologists, 60 cardiac surgeons, and 50 cardiac anesthetists. So, and again, we have to follow a lot of roster system, we have to follow reservation. But still, these are some
Right,
of the...
sir. Thank you very much. I think
Another thing, handling the crowd is a biggest challenge.
Right.
Because 95% walks into the hospital without appointment, and you don't believe 1,500 to 2,000 outpatients. Daily you used to do 1,000 echoes, 900 echocardiograms, and 200 angioplasty put together daily. And what I did was, because we also opened what is called special ward, deluxe ward, and also what is called single window master health checkup area. Why I did was, hospital, because people perception is government hospital is only for the poor. So I created a system where it's also an hospital for the rich, elite class, and VIPs, and that was acting like a cross subsidy. So we are charging those group, and that was serving as a cross subsidy to the poor people. So this is how the system has developed. And I also built up a poor patient corpus fund. When I took over, it was about 5 lakhs. When I left the institution, it was 150 crores. 150 crores poor patient was billed, and the interest generated was spent towards the poor people. And I saw to that nobody should go. Of course, during my tenure, 8 lakh procedures were conducted. 8 lakh procedures, including open heart surgeries to cath lab interventions, angioplasty and stent. To the best of my knowledge, no patient has gone untreated for the want of money.
That's, I think, the main... I think we've given a lot of tips to other public institutions probably on how to run it, but then I would definitely want to know what are some of the challenges, because you treat, Dr. Nageshwara Reddy, you treat a lot of broad range of patients. So what are some of the challenges that you face in the private sector to actually, one, to run the private sector alone, the hospital alone, and the other one on to have that compliance with the government on several health schemes that are passed, and also the demand for empanelment and things like that? What are your challenges?
Thank you, Chetna. First of all, I'd like to thank the organization, especially Vasu, for this unique conference. As Dr. Manjunath said, it's a very unique conference where we exchange ideas in a very free pattern. Secondly, I'm extremely honored to be on the same dais and panel as Dr. Manjunath, who's not only a legendary figure in cardiology, but I think now he has done something very, very good, a professional going into politics to change the health scene. I think this for us is a blessing, so extremely honored. Thirdly, as a gastroenterologist, I know that a hungry stomach gets an angry brain. So I'll try and be very short. My position is exactly opposite of Dr. Manjunath. He works in a public sector. He created, with all the difficulties, a sector which was much better than all the private hospitals. I'm in a private hospital and I'm trying to create with the government a public type of care. Now, this is very oxymoron. Public-private care is a very oxymoron word. They don't go together. Private care is supposed to be tertiary care. Public care or public health care is supposed to be at the root of the public health, that is preventive care. So how can both mix together? Because one way is that, again, I think what all Dr. Manjunath said is absolutely true about an organization, whether it's public or private, how to build up confidence to youngsters, all those things. But one of the problem now we face in the private sector in this country, a huge suspicion. You know, everybody thinks these fellows are making money, they're getting into, they're all corrupt and that type of thing. So the first thing that we have to establish as a private sector is a trust factor. So we have to convince the community and society that what is being done by these private groups are in the interest of the patient, and this trust is very important. Unfortunately, there are going to be some black sheep in every society. So because of that, we have developed a negative image. If you ask how many in this who are non-doctors think that private doctors are doing good work? Very few, only one. See? How many think that public doctors are doing good work? Really much more. Yeah, standing up and telling, that means, yeah. So more support. So you see, in general, private doctors have less support compared to public doctor, which is right, because public they sacrifice. So if somebody like a Manjunath is a role model to do something in public health, we don't have role models in private sector. We don't have somebody who can look at saying this chap is doing in private sector. But so first important thing for us is to build that role model. The second thing is our interaction with the government is not always very positive, in the sense government has so many schemes. Again, I know that Manjunath is an MP here, so sometimes sensitive information, maybe I have to be a little more polite, but anyway, the problem is government has schemes like Arogyashri in Andhra Pradesh, Ayushman Bharat in center. All these schemes are okay to start with because health insurance is important, but they are misdirected. If I have to do in a tertiary hospital with the very complex surgeries being done, state of art, we have the best endoscopy unit in the world that's certified by all the gastroenterologists. If I had to do endoscopy at a price which is being done in a small hospital in Karimnagar and Nizamabad, it cannot be possible. The government should, make into different tiers of hospital, different rates should be there. In our country, one of the worst things is that there is no regulatory body for private hospitals. Nobody has ranked hospitals as A, B, C. That's done all over the world. We don't have ranking. So randomly, it depends on the patient choice. If the building is 5-star, they think it's a good hospital. That's not right. There are many other things, like again, Dr. Manjunath said, systems that work into the hospital, the kind of air conditioning, the type of hygiene standards and so on. So we have to work. So first, just to summarize, one, we have to create icons in the private system so that you're looked upon as delivering good health service that happens. For example, Mayo Clinic, private hospital, iconic. So we have to create that one. Number two, we have to work with government in a better way, and hopefully with people like Manjunath we'll be able to do, where different tier systems are given for the insurance on. And most important, we should recognize that public health is still the government's domain. When we got independence, all health was public health. Then this private sector came up. Even now, private health should be tertiary care health. We should be looking after tertiary care. The public part, like vaccinations part, clean water supply, all should be. We can aid from the private side. For example, at AAG, we adapted 40 villages in Patancheru area. We give complete poor. we try and give them the state-of-art care. But that can be done, but not in a big way. Public health is still the government's domain.
So suppose when you say this, I mean, I'm actually intrigued because the moment you say that, is there a need for this public-private partnership? I mean, there is this PPP model.
Yes.
The moment you propose it, there is a lot of opposition which comes in. So is there a middle ground at all? When you're saying, look at only the tertiary care, then is this needed?
There is a middle ground, like what Dr. Manjunath said, there is a middle ground. The middle ground is that in some areas, the private sector will be predominant, the public sector will play a smaller role. This includes general health of the public and all. In some areas, the public health is predominant, and the government should take help of certain private hospitals, certain expertise. For example, areas of research, artificial intelligence and so on, which is going very fast now. This should be, so I think the public-private partnership is a must in our country. At what levels this happen can be different in different situations.
So like you said, there needs a regulatory body to actually look into this and
we don't
bring
have a
that.
regulatory body. I think Dr.
Absolutely.
Manjunath knows that.
Dr. Manjunath, I think this is a question for both of you. Dr. Devi Shetty, founder of Narayana Health, recently in an interview said, government-funded healthcare can't work in countries with large populations. So do you agree with this? I want to ask both of you this question.
No, certainly I don't agree with that. For example, this Ayushman Bharat, of course, earlier to Ayushman Bharat, Andhra Pradesh had, then United Andhra Pradesh had Arogyasri, Karnataka had a similar scheme. Now, of course, Ayushman Bharat is one of the biggest public health, scheme that is operating in the country. What has happened, I fully agree with Dr. Nageshwara Reddy. Actually, the package rates under Ayushman Bharat was not meeting the actuals actually. So in 2022, there has been a revision, what is called HBP 2022. I think that is quite decent. But unfortunately, many states have not adopted these revised rates. For example, for bypass surgery, the earlier package rate was 95,000. In this revised, it is almost to 1,30,000. At least it's quite better. So if these revised rates are, some states have adopted, but some states have not adopted. I think even Telangana, Andhra, Karnataka, I think many states have not adopted. So if they adopt these revised rates, for example, for congenital heart disease, complex heart surgery, the revised rate is somewhere around 2.2 lakhs. Earlier it used to be 1 lakh. So these revised rates need to be adopted, and it is a joint responsibility of both union government and the state government because it works on 60-40 ratios. So they have to spend some money on this. So this is where because we always talk about health and education are priorities, but when it comes to funding, it is not adequate. That is one thing.
Yeah, Dr. Reddy.
Another important thing, see, we should start establishing high quality multi-speciality hospital in tier 2 cities, or maybe even to some extent in a mid-sized tier 3 cities, because the travel time radius, should not be more than 50 kilometers. So this is because most of the, top class 5-star hospitals, they are getting concentrated in tier 1 cities. So we should always look at establishing a similar hospital in tier 2, then we can reach the larger portion of the population.
Dr. Reddy,
Travel radius should be 50 to 60 kilometers. That is one thing. And we should also adopt what is called hub and spoke model of treatment for emergencies, whether it is heart attack or brain stroke. Hub and spoke model, that means they are all time driven, because for example, you take heart attack or you take brain stroke, for every 30 minutes of delay in initiating treatment, risk of death increases by 7%. So if they have to travel hundreds of kilometers, their precious time, golden hour is lost. So this hub and spoke model, that means Taluk Hospital will give initial medical treatment like thrombolysis. Now that is called 1-minute injection of tenecteplase, clot dissolving medicine. You give it there, that any MBBS doctor can do with little bit of awareness about it. Then after 3 to 6 hours of stabilization, they can be shifted to the nearest tertiary care hospital in bigger cities. So that hub and spoke model should be adopted because today 30% of deaths in India is due to heart attack and stroke. 30%, that's a very big number. And this is how hub and spoke model. And
Sir,
as
I would want Dr. Reddy to just
No,
give his
actually,
opinion
I
on...
absolutely concur with Dr. Manjunath. In a low-income country like India, I believe with the large population, 70% of healthcare should be government's responsibility. Only 30 or 20% of urban, high-end people should be. But unfortunately, if you look at the budget that's happening now, only 2% is devoted to health. Again, I'm not blaming the government because there's so many other schemes that have to go. So we have to, as professionals, fight for that and see that more allocation is done to healthcare. And of course, research is secondary, but also healthcare, so that if it goes to say 5%, if we look at other countries, it's 13, 14, 15%. So that may be one important aspect. I think, Manjunath, that's
So
one
there
thing
are,
that...
I mean, I agree to that. There are so many schemes like you were talking about Arogyashri and all that. But then, the problem is when we look at insurance per se, so there is a lot of push from the private hospitals as well now to take up insurance.
Again, you're accusing us now.
No, we're not accusing. I mean, I don't know any other way. Like if I have to take care of my health, I personally believe that probably I have to go in for an insurance because I can't depend on a public health insurance, right? So now, but then this can also mean that it can become a hindrance to access at all, access to healthcare at all.
I don't think
US has kind of failed in
No,
doing
I think it's
this.
the wrong concept.
So
US
please,
has
could you explain
failed,
on...
No, US has failed not because of insurance. US has failed because their healthcare was pushing to very high-end tertiary care, which the society cannot afford. You see the same thing in Europe. For example, in Germany, in Belgium, it's a social, again, like insurance-based medicine, extremely successful. In US, it failed, and to some extent in NHS, because they were trying to push, if you have a terminal cancer patient and you want to keep him alive for next 1 month using costly gadgets and so on, and if you look at the practice in US, I've been so many times there, they just waste so much of disposables. If that is there, then the insurance premiums are going to go up. People cannot afford. But the kind of insurance premiums we have in this country are extremely good for the patients. It is a wrong concept. I would say opposite of what you said, that we should promote insurance as it is now, so that more and more middle class, upper middle class, that type of people have access to insurance. Otherwise, a middle class family sometimes, again, Manjunath, like when they come for a major cardiac surgery, sell their whole house, sell their farm and all that and come. That's not right. So insurance is a must.
No, in fact, Ayushman Bharat actually has recruited 12 lakh crore families, which comes to around 60 crores. It covers
So
60 crore
private
population.
medical insurance.
No,
So,
yeah, that is
yes.
one. Another thing, in the last 5 years, nearly 6 crores patients have been treated under Ayushman Bharat. That's a great thing. See, another important thing, our Indian still, despite all these, some of these limitations, the people who appreciates the Indian healthcare system is our own NRIs. When they come and visit, oh, they are puzzled. Oh, I'm getting this procedure done same day. I could able to see the consultant same day. Are you giving the report same day? Yes, we are giving the report same day. So the NRIs who are visiting, in fact, many of them are, coming to India for getting some, procedures done.
Right.
I agree with you, because I think our system sometimes is much more efficient than what you have in US.
Correct.
All we have to do is make it more system protocol based, then we'll be better.
I think this is my last question for this panel. So give me 5 regulations that if you had an opportunity to regulate the private healthcare, then what are the 5 things that you think you would bring? And similarly for Dr. Manjunath, if it is public healthcare, then what are some 5 regulations which you think you should bring?
So 5 is too many.
Okay, probably maybe 3. Can we do 3?
Okay, first of all, I think the quality of hospitals should have a regulation that all the hospitals, nursing homes should be registered, which is being done. After the registration, all of them have to be audited and said that this is what you're grade A, grade B, grade C. That's very important. Second, all the hospitals in the country should have an audit system where, you know, you have a report card. Every month, say our hospital puts up a report card, so many admitted, so many deaths, so many, so that is not, the quality metric should be put out to this thing. And third, I think we must have, all the hospitals should have their internal regulation with committees who can then look after various aspects that's happening. So we have to be self-regulated, we have to be partly regulated by the government, but this is very important to have quality metrics which then say this is the quality of our hospital.
Okay, thank you, sir. Dr. Manjunath, what do you think?
Yeah, see, number one, as during my initial remark, what I was talking about, same thing, we need to strengthen the existing public health facilities, whether it is medical colleges or whether it is hospitals. We have to first strengthen the existing facilities with adequate manpower. Doctors, nurses, technicians, that is one thing. Because, yes, we are always believe improving the healthcare is not just constructing new hospitals or new medical colleges. Today we have 707 medical colleges, to be frank. So another important thing is, yes, we have at this point of time, we have close to 14 lakhs allopathic doctors. We have 4 to 5 lakhs Ayush doctors. So our requirement may be another 2 to 3 lakh additional allopathic doctors that we are achieving, because today our MBBS seats are 1,10,000, and PG seats are also about 70,000 PG seats. So there is a maldistribution actually. Not that, of course, healthcare system in India is also, we see diversity in the healthcare system. It's quite good in the southern India when compared to north and northeast. So we see diversity in the healthcare system. There has to be uniformity in that. And we have to really, another important thing, we are talking about this only number of seats. The quality of training is very, very important. So quality of the products. So that's what I was talking in the parliament yesterday. The number of MBBS seats in any medical college should not be more than 150. If it is 250 and all, in many medical colleges, we see there are more medical students than the patients. So the training will not be adequate, and hands-on experience also will be very less, and off-baked, undercooked, undertrained doctors, sometimes they are more harmful than the disease. So that is one thing. And there has to be, even in a public hospital, there has to be a limited decentralization and delegation of powers. For everything, small things, you should not go to the government. There has to be some decentralization and delegation of power to the heads of the organizations, and that is one thing. And yes, we have to rope in certainly the CSR activities. You have to rope in CSR activities. Certainly, nowadays, a lot of CSR funds are flowing, so we should establish that system. And the fourth one is, yes, there has to be a good public relation mechanism in a public hospital. Public reception should be good. The first contact is the one that matters. And one has to also bring in some sort of an incentive scheme for the employees. Incentive schemes should not be only for the doctors, even from the sweeper, for a technician, even a Group D worker, that's how we should improve the system. And another one is, yes, as Professor Nageshwar is telling, we have to work together. So because trust is a very, very important factor, and the healthcare should be affordable, it should be accessible, it should be available. So that is one important thing. And health for all is the desire of the nation. It is the dream of the nation that healthcare should be for all. Health for all should be our right. But hospital services alone will not provide health for all. You should provide clean air, should provide clean water, and you should provide clean food also. These are the three things, health for all.
Thank you very much, Doctor. I think while the motto for both public healthcare as well as private is health for all, let's hope that we actually achieve that and we take some ideas, whatever has been discussed here, and not just leave it here in the room, and it actually reaches the parliament. And, Sir Dr. Manjunath has the onus now to take it forward, I guess. Thank you very much. It was wonderful panel. We can now open the discussion
If you
for the
would indulge us, I think a
questions.
couple of questions from the
Yes,
audience.
please.
It's a managed healthcare system which hospitals like Narayana Health has been introducing, and it's very prominent in countries like US. So what is its relevance and applicability in a country like India where income levels are pretty low?
We-
Managed healthcare is a concept where a single entity, like for example Kaiser in US, takes up care, and Narayana to some extent has done. It's a concept where Apollo actually started it also long back, where a single group of hospitals insures the patient, and the patient can go only to that group of hospitals, nowhere else, unlike other insurance systems. In India, it has not picked up for several reasons. One of the reasons is that there are only very few large hospitals like Kaiser. There's so many in US, number one. So it can't be single monopoly, and then people will not take that insurance. Second, it has been misused. Managed care insurance has been misused a lot, so it failed. So that system in India is unlikely to work because of all these reasons.
So regarding your other question is, most of the patients want only the senior doctors to operate and all, but actually inside, many of the youngers only will be operating under the name of a senior. So that is, youngsters will be operating under the name of the senior, that is fine. This is where quality of training is very, very important. See, today, the clinical training has taken a back seat because of explosion of technology. So still that basic science teaching is basic examination is very, very important. So it should not be just gadget, or it should not be investigation centric. It should be a patient centric treatment, and basic examination still holds the key. Despite explosion of technology, we have various diagnostic measures. We have CT, we have MRI, we have ultrasound, we have various tests and all. Still, three T's are very important: talk, touch, and treat. So that brings in trust. Talk, touch, and treat, because physical examination, and we have to give some time for the patients also. At least we should listen to their problems 5 minutes, because in 80% they give you the diagnosis. So definitely this is where I am telling, yes, we need more specialists, I agree, but during training, if you have more number of, for example, in some colleges I have seen MS General Surgery, 30 seats a year. So over a period of 3 years, 90 postgraduates in general surgery, and they get certificates, but their clinical exposure is less. So I think the quality of training is very, very important.
Thank you, sir. Any other question?
Yeah,
Sir.
if I can ask one. Good evening, sir. Good evening, ma'am. So, just would like to share, first of all, this panel discussion was so relevant and important, and I think it should be taken further. One question that I wanted to ask you is, in the government colleges today, or not colleges, hospitals mainly, that you will see that the staff is overworked, but the hospital itself is understaffed. So you will see a lot of people that are working shifts for continuous days on end. So when the problem exists of being overworked and understaffed, it's very contradictory. When you can take more people and reduce the number of hours and prevent mishaps that happen in hospital because of this. So why is this problem not addressed yet, and what are your thoughts on this? How can we solve this?
No, in fact, I have made it very clear.
Yes,
we have to create post. I think this is where the problem is occurring in public hospital. So the building comes, facilities will come, instruments will come up, but more important, we have to have adequate number of staff. So the manpower requirement has to be addressed, then work will be shared. That is.
Thank you, sir. Next question.
Sir. Dr. Manjunath, my name is Dr. Kuldeep. I have a straight question to you about what is the top 3 priorities to the government right now in the health?
No, see, one is yes on the one is on the preventive side. So, for example, today cervical cancer is one of the most common cancers among women. So, and it is proved beyond doubt, this vaccine, cervical cancer vaccine, prevents this particular cancer to an extent of 90%. So, for all high school girls should be vaccinated with this vaccine, and it should be brought under immunization program. If it is brought under immunization program, certainly we can reduce the number of prevalence of cervical cancer. That is one priority. And second is, yes, we have to, from time to time, we have to really revise these package rates under Ayushman Bharat scheme. Then more and more number of private hospitals get empaneled, and otherwise what happens, the burden will be more on public hospital. When the burden is more on the public hospital, then somewhere down the line quality suffers. So you have to revise these package rates, and you have to see that every state in this country adopts that revised rates uniformly. So that is the second one. And the third one is, see, we are always we talk about starting a medical college. So a second medical college should not be given within the travel radius of 50 kilometers of the first medical college. So, and we should establish this in many semi-urban and rural areas, so that covers that population.
Addition to
Thank
one-
you very much, sir. I
addition
think
to-
we're...
Just one question.
No, sir, we really are tight for time. I'm really sorry. Thank you very much. It was a wonderful panel discussion. Thank you.